Welcome to the Ask Dr. Deanna show. I'm Dr. Deanna Osborne, your host. Join me weekly as I cover various health-related lifestyle medicine topics that you get to request. This show is for anyone who wants to proactively improve their health position. I hope you enjoy the show. Hey, everybody. Welcome back to the Ask Dr. Deanna podcast. I am excited to be with you today. And today is sort of like a part two. Last week, we talked a little bit about hormone imbalance and specifically hormone imbalance for the perimenopause or menopausal woman, which is usually somebody who's in their 40s and 50s for most of the time. But this week, I thought we would go a little further and talk about infertility and a little bit about PMS as well. This is something that typically affects more that reproductive age female. So we're probably focusing more on with some of the PMS stuff, from the beginning of, puberty all the way through to, let's say 45 or so. So infertility is a big one. And this is a hot topic. It is something that affects millions of couples. And is definitely something that needs to be addressed. There are infertility clinics that have popped up all over, and they've done a great job with helping a lot of women to be able to conceive and to be able to have a pregnancy and so forth. Today, I want to talk a little bit about something that I learned along the way that I've really utilized for about 20 years in my practice that has helped dramatically with infertility. And oftentimes when someone has infertility, it is that they are not ovulating. And if you don't ovulate, you can't get pregnant. That's the bottom line. So the first question for a lot of people with infertility is, are you ovulating? Well, there are simple tests that you can get that are available over the counter that will help you to know if you are or not ovulating. So that's the first question. Sometimes when a person is not ovulating, and there can be a variety of reasons, but one of the reasons can be something that is a metabolic issue, which is when you see something that's metabolic, oftentimes that's diet related. So something called polycystic ovarian syndrome or polycystic ovarian disease is a syndrome in which a female is typically not ovulating. They may struggle with some weight gain issues. Typically, they do have weight gain, but not always. So they're not ovulating. They've got some weight gain. Maybe their periods are irregular. They're not coming at a consistent level. Maybe they have one every 3 months. Maybe they have one a year. Those are some of the symptoms that we'll see. Sometimes they will have more androgenic hormones, which would be more of the testosterone, more testosterone in their system. And so sometimes they'll even develop a little bit of extra facial hair. That could be a symptom, or just hair in unwanted places. Okay. So basically, for that person, what I have found is that progesterone will work for them. Progesterone and a good diet will work for them. And if I can have a patient follow a program, and we've actually outlined, how to do this in Dr. Deanna's Healing Handbook, available at deannaosborne.com. But when you look at what is going on there, basically they're not ovulating. Progesterone will make you ovulate. So if you are low in progesterone, you're not going to ovulate. That's also the reason that sometimes women get pregnant and then they lose the pregnancy in the first trimester. It's not always the reason, but oftentimes it is because they are low in progesterone. They're not producing enough to maintain the pregnancy. Progesterone actually gets its name from progestation because it is the pregnancy hormone. It is so much needed for pregnancy. And so for a lot of women, when they come in and their periods are irregular, they're not sure if they're ovulating, they've just been struggling. And typically this person will say, I've been trying to get pregnant for 4 years and I can't. The first thing I'm going to do is have them change their diet, and I'm going to have them go low carb. I'm going to have them go no more than 50 grams of carbs per day. Ideally, no sugar, no grain, and let's incorporate some intermittent fasting as well. You can go back to Fasting February and hear all of those. So we're not going to go into that right now. So have them incorporate the intermittent fasting, get the diet under control. And then I will typically have them use transdermal progesterone, available over the counter, which is a topical cream that's absorbed through the skin. It's bioidentical, is important. That means that it's identical to the progesterone that your body would normally make. And they basically will use this every day for about 90 days. Why for 90 days? They're using it for 90 days to basically nourish the ovaries, okay, and to get them back into a system of ovulating regularly. After 90 days, I have them stop, and they usually will have a menstrual cycle. At that point, then I will have them start using the progesterone in the way that their body would normally have it, which is the back half of the cycle, kind of from the time they ovulate through when their next period starts. Okay, so we're getting very technical here. I know that, but this works. And typically, what I find is for that woman who's not ovulating and who's having some polycystic ovarian syndrome, and this is the cause of her infertility, it is not uncommon for them to find that they're pregnant in month 4 or month 5 of this. Okay, there are, of course, no guarantees, but I can't tell you how many women we've been able to help in this category just by following this simple program that, again, it's outlined in more detail in the book. In addition to that, for those women who are in that reproductive phase, they're having a menstrual cycle. Pretty much anybody who has a menstrual cycle, PMS is another reason that we see a lot of mood swings, irritability, irrational thinking, irrational behaviors, and so forth. And so, what is that? That's usually PMS, premenstrual syndrome. It's usually the time right before their menstrual cycle starts. And sometimes they're experiencing symptoms because they've just dropped low in the progesterone. So sometimes progesterone can make a big difference with that symptom as well. And then for many women who are struggling with PMS, again, it is triggered by a hormonal imbalance, usually the lower progesterone levels. That's why it happens right before the cycle starts. And getting on a really great diet, the one I mentioned earlier, which would be lowering the carbs, no sugar, no grains. During that phase, it would be very difficult for a woman to fast for any more than 12 hours. We should all be fasting for 12 hours every night. That is a normal thing to go 12 hours without food. But for that particular woman who's struggling with PMS, there are a significant amount of like an increase in cravings, usually foods that are going to help increase serotonin levels. Those are the foods that you would see being craved. So what are those foods? Well, chocolate is one of them. Go figure, right? Everybody always knew that there was something about that chocolate, but chocolate would be one of them. And then carbs typically would increase serotonin levels as well. Why does this happen? Why are these cravings happening? Why would somebody, gravitate toward that? It's basically because as that progesterone level drops low and they're about to start their cycle, you're going to see a little bit of depression kind of come in, a little bit of anxiety, depression, because serotonin levels are dropping as well. So again, a simple way to do something. What can I do? If you're listening today, you're a listener and you are wanting to know, before I go to the infertility clinic, before I go on a medication for, PMS, which there are medications for it, what can I do? Okay, well, here are some simple things that you can do that can have a dramatic effect, a big difference for you. One is reducing the carbohydrate content to 50 grams a day, no sugar, no grains, trying to eliminate that. Okay, nourishing your body, getting adequate sleep. Try using a little bit of transdermal progesterone. Again, in the book, we outline how to use it for PMS as well. It is a little bit different, but that makes a significant difference. And if you're that person who thinks, you know what, I just want to have my hormones tested and I want to know exactly what's going on, we can actually test at certain phases of the cycle so that we can see, is this the issue, or is it something else that's going on? A new virtual site, restorationhealthllc.com. Restorationhealthllc.com is a hormone balance and weight management virtual practice that basically offers full hormonal testing as well. But it's not always necessary. So if, as I'm talking to you and you are, you are having some of the symptoms that we've discussed, it might be worth just doing the diet that I mentioned, okay, following that, reversing any insulin resistance. That's another thing. If you're struggling with infertility, definitely ask your doctor to test for your fasting insulin level. If your fasting insulin level is high, that's a hormone. It's going to have an effect on the rest. And you've got to control the diet to the point that those insulin levels come down. That's something that can be tested as part of that hormone panel through Restoration Health as well. So I hope this has been helpful. It has been a great, just a blessing to be able to work with so many women who are struggling with this whole infertility issue that is associated with anovulation or the lack of ovulation, and to be able to see them turn that around, get pregnant, have babies, and just make such a difference. So I remember a person who was going through infertility with an infertility clinic and wasn't getting results. It wasn't working. And then ended up using progesterone and got pregnant with the progesterone, went in to her gynecologist and said, "Oh my gosh, I got pregnant using this progesterone." And he nodded and said, "Yeah, progesterone will make you ovulate." So sometimes that's it, and that's all that's needed. So anyway, pick up a copy of the book so that you know what to do, and kind of the guideline to follow. So thanks so much for joining me today. I hope you will plug in again next week as we continue our journey on health and wellness. Thanks a lot. I hope you enjoyed that episode. For more information, visit me at deannaosborne.com. Find me on Facebook, Instagram, and Twitter at Dr. Deanna Osborne. I really want to hear from you, so message me. I love taking your messages and creating topics from them. Please rate, review, subscribe, and share my show with those who have an interest in health and wellness. Thank you for tuning in, and see you next week.